This could be the year medical marijuana dispensaries finally get off the ground in Hawaii.
I'll put in a provision so that every provider, every physician that prescribes can do it in our state, and that any patient that needs it, irrespective of their diagnosis, as long as they go through a safe dispensary.
Medical marijuana has been legal in Hawaii for years now, but the way the law is written, it remains illegal to obtain the drug even for medical purposes.
Because right now, they're basically having to buy it illegally, and that doesn't make any sense at all.
Now, after I got my card, which was easy, I was told to go to the streets to buy it.
Last year, a task force was convened to study the subject.
Current law tells you, here are the rules. You must follow these rules. Don't do anything illegal or boy, you're going to get into trouble. The very first problem is there's no way to legally buy seed.
The task force held hearings across the state, including here in Hilo.
We don't want to be telling our patients just go to the.
Yeah, because it really don't make much sense.
So that's one of the motivations for this.
Hawaii Island was particularly vocal about what they would like to see in the future.
I do think dispensaries need to be limited in number, but I think they need to be within reasonable distances.
One dispensary wouldn't be enough. 10 would not be enough. I think we should have dispensaries in every town.
10 dispensaries, like I said before, yesterday, will create multimillionaires overnight.
It's really hard to grow, to have a business like the size you guys are suggesting. If you're thinking just 10 dispensaries, if you add it up, a dispensary, if you have a guy just doing 10 minutes at the door, each person, they can only take care of 50 people a day. And that's a line, lined up outside.
The task force recommended the state establish medical marijuana dispensaries. Now it's up to the state legislators to act on that recommendation.
Because it's been demonized and people have said things about it that just aren't true. And I believed a lot of those things myself until I started looking into it more.
2 elected officials from West Hawaii, both of whom are also physicians, shared their thoughts during a recent community meeting in Kona.
The task force that put the recommendation actually called for the application fee to be $20,000, but if you didn't get it, you would get all but $2,000 of your application back. But if I can be candid, anyone who opens a medical marijuana dispensary is going to actually make a very large amount of money in all likelihood. That's what's gone on in the mainland. From my perspective, it shouldn't be about large profits from people that want to come in from the mainland. It really should be about the patients and their access. So I'm not worried about that, honestly. The pharmaceutical industry really takes great advantage, from my perspective, of patients. The broader pharmaceutical industry, and incredible fortunes are made off of drugs, whether it's at, even at Costco, where there's a lot of discounted drugs.
I'm not so concerned about the money for the real, brick and mortar dispensaries, because, they may need to be substantial. But in the meantime, I think we need to look at how to provide marijuana to people, right now and for the next couple of years if these dispensaries aren't going to be set up. And I think if we do it wisely, then what we set up will complement the dispensaries. We are not proposing that people will not be able to grow their own medical marijuana in the future. We're not proposing to stop that. At least I'm not, and neither is the dispensary task force saying that. So what I do think that will happen over the next year or two is more people will join together in collectives and cooperatives and grow their marijuana as a group, so they can grow more plants, grow different strains, and explore the different strains, which is going to be very important for when the dispensaries come into play. And ideally, those people will be developing expertise that will allow them to provide material to the dispensaries when the dispensaries get set up. So I think the dispensaries are going to be only part of a system, but a very important part of the system, because there'll be people in there that have expertise, knowledge, and most people just haven't been able to do well at growing their own marijuana. So there are many people that would be willing to pay the prices that dispensaries pay, although I want to keep those as low as possible. This is a medication, and right now the health insurance industry isn't paying for it. So I don't want to stick the people who often are the poorest people that need these medications. I don't want them to have to pay a lot of money for this. So we're going to try and keep the cost down as much as possible.
a lot of the other drugs worry me even more than marijuana in general. I'm very worried about OxyContin getting to kids and Vicodin getting to kids. And we now saw this year was the first year we were able to demonstrate that more people died in the state of Hawaii from overdose than from car accidents. So there's this other thing that on the side that we're working, this other kind of parallel amount of work that we're doing at the Capitol, all of us together, to decrease those drugs in society. And I think that might be one of the benefits of a sane medical marijuana system where fewer people go to physicians or nurse practitioners to get large prescriptions of controlled substances that also end up in society. And I think in aggregate we're going to have a healthier society, but we'll really have to be careful about young people. And a lot of the monies that would come from fees and whatever, I'm proposing go into education, into the schools about addiction, about the consequences of taking some of these substances on development.